Hi, my name is Teresa Doerre, and I'm an orthopedic surgeon and sports medicine specialist with the GWMFA. I'm going to be talking to you today about injuries that runners can sustain to their knee and injuries of the knee that can cause pain associated with running and training for a race. One of the most common types of injuries that we see amongst runners and athletes that are training for a race is something called runner's knee. And runner's knee refers to a couple different injuries around the knee that can be sources of pain for runners. One of the most common aspects of this is something called patellofemoral pain, which is pain in the front of the knee joint underneath the kneecap. Another area that can be painful for runners as well is irritation of the iliotibial band, or IT band as it's more commonly known. The treatment of pain related to these injuries, which runners can experience before, during, or after a race, starts with symptomatic management. And we recommend using rest, ice, elevation, and use of an anti-inflammatory. Those treatments are to help alleviate inflammation and pain associated with the injury. The other half of the treatment of these kinds of injuries is actually aimed at the prevention of the injury in the future. And we do that and accomplish that by helping runners strengthen mainly their core, hips, and knees in order to help with injury prevention. We also recommend maintaining good flexibility with stretching of the IT band and the hamstrings. If runners are still having pain despite these treatment measures, and there's signs of persistent pain, swelling inside the joint, or pain that keeps increasing with activity despite some of the treatments that we've discussed, then I would recommend following up with an orthopedic surgeon or sports medicine specialist. I hope you had a great race, and thanks for participating in the GW 5K.